Today you will learn about three components that are very important in the medical field: the EOB, the ERA, and the EFT. The EFT, or electronic funds transfer, this is a direct deposit of monies from the insurance company to the provider, much like a payroll direct deposit of one's paycheck. An EOB is an explanation of benefits. That would be the paper form of a check stub. An EOB will list the patient's name, the date of service, the billed amount, the amount that is patient responsibility, and the amount paid by the insurance company. Much like a payroll check that you get to show how many hours you worked, how much money you made prior to healthcare benefit deductions, Medicare deductions, and then essentially how much your check is. That is the exact same for an explanation of benefits. Recently, the insurance company, for the past, I'll say 4 or 5 years, sends a copy of the EOB to the provider as well as to the patient. This is to help the lines of communication to make sure what is being billed and charged and financial responsibility from the patient is provided to the patient so that they understand what's going on, what's being billed, and what they're responsible for. An ERA, or remittance advice, is the electronic version of an EOB. At some point during your externship, you will have the opportunity to set up a particular provider to an ERA for a specific insurance payer. When you look in your binder, you will see that there are a few ways to do this. One way is through Office Ally, which is our billing system. The second way is through Availity, which is a third-party clearinghouse that houses multiple insurance payers' information to make it simpler for providers to obtain claim status, benefits eligibility, and authorization. You can also go directly onto a website for a particular insurance payer and sign up there. And then another third-party house is Navinet. So today I'm going to show you an example of each one of these. Office Ally, you're going to go to the website officeally.com. It will bring you to the home page. You will hit Resource Center, Payer Enrollment Forms, and then Electronics Remittance Forms. As you can see, the ERAs are set up in alphabetical order. Don't worry, I'm going to set these all up for a particular payer, for one particular provider. Like I stated, we get a list of one specific provider. You would have to set up one of these or multiple of these per insurance company, but definitely not all of these. So then we click on an example. Office Ally is awesome at providing an instruction sheet prior to you filling out the ERA. It is important that you take the time, you read the instruction sheet. Really, any time that you're filling out any documentations for your provider or provider office, you want to read it, make sure you understand it, read it again. So these are the instructions. Since Office Ally is a clearinghouse billing system, a lot of their forms will have the option to sign up for more than one ERA payer on one form. I say that you do it every single chance you get. This will eliminate you having to sign up another time, and it's more efficient this way. You never know when you're going to get a patient that may have one of these insurances. Now, after you have the option to select multiple payers for some forms, or the form will be just specific to that one payer, it's always going to ask you the provider information. The provider information will be of basic things, such as the provider or practice name, the address, tax ID number, EIN number, or NPI. Just for clarification, a tax ID number, or tax identification number, or TIN, is the exact same as an EIN, or employer identification number. A tax ID number and an employer ID number is, for a term of easier understanding, a social security number that you assign to a person. A tax ID number or EIN number is that same type of number that is associated to a practice or business for tax purposes. The NPI, or National Provider ID number, that number is, let's say, like your driver's license. So when you become a driver, you get a driver's license. That driver's license number goes with you wherever state you go. That is the same as an NPI. That driver's license number tells people that you have done the necessary licensing to be able to drive. An NPI is a number that is provided to providers that state they have gone through the necessary licensing in order to practice in their field. Now, all provider information for all reasons in terms of working with Favorite Medical can be found on your provider list. Your provider list can be found either in your binder or on the website under the drive, the Google Drive. So then you would complete all of that information. The contact information is always Favored Medical's billings information, whether it's the phone number, fax number, email address, or name. You want to always sign up an EFT using the provider federal tax ID number, or TIN, or EIN. Never do you want to set up an ERA with an NPI. And the reason being is because providers will sometimes move practices, move to different companies, change their company name, which means that they would change their tax ID number. Their NPI number never changed, but because you're dealing with sending out claims, receiving monies, you want to make sure that all those transactions are associated with the tax ID for tax purposes instead of an NPI. And then it will always be a new enrollment and then your signature. For Navinet, what will happen is that you will sign into Navinet. You will go to My Account. Then you will go to My Office. You will click Add a Tax ID Number. So let's choose a tax ID number. Put it there. Then you would choose a practice name or the provider's name. Go to next. Yes, you want to be able to have access to all of these that populate. Hit submit. And then it provides you a case number. You do want to write down that case number just in case if there's any issues, we can print that case number out and contact Navinet. Then you close. The next one is through Availity. You're going to go to Availity and its home page. Start a registration. And because I already have an Availity account that I want to be able to check all of my provider's information under instead of logging in and out and multiple times, you're going to select yes, which will populate a user or a password, and if it does not, please let me know and I will provide it for you. You're going to hit log in. That's my information. You're going to hit continue. You're going to set up a practice for a provider or physician's office. You're going to use your provider list and select the provider's information that you need to move forward. Physician practice, and then next. It is again asking you for their address, which can again be found on the provider's list. So we're gonna copy and paste that information. Again, we're going to list my phone number and fax. Which that information can be found on the front cover of your binder. Leave the My Organization Does Business in More Than One Region left unchecked and hit next. The answer to the first question is no, in which you would then put Lloyd Hopkins, our phone number, and Lloyd's email. You want to select I do not have a check, and then the answer to the second question is yes. Hit next. Review the information. Accept that you had fully read and understand the agreement by scrolling down and hit submit. It does provide you an application ID. It is a good idea to write down that application ID number. Again, if there's any issues or concerns, then we will be able to definitely rectify those with the proper information. Now we're going to test a direct insurance setup for ERA, which will all be different based on what information is needed. So we log on to Cross Blue Shield using the user and the password that you do have access to through your binder. You go to Account Management and then Tax ID Management, and you select Add Tax ID. So again, you're going to get the tax ID number from the provider's list. Add it there. Tax ID description is, I usually put the provider's name. And then tax ID. Since it's already in the system, we can't add it again. You see it up there, but it's easy just like that. Now I just want to take a moment and show you an explanation of benefits, just so that you understand what they look like. See here, you have the insurance company's information, patient's name, the doctor's name, the claim number. Sometimes it will provide the patient account number from your billing system, the date of service, the items that you billed, the billed amount, any contractual adjustments, anything that is required to be written off, the amount that you may pay, any deductible amount that you're responsible for, copay, co-insurance, items none covered, and then ultimately how much you've paid. You will also have a section that says note or remarks, which then you will have a description of them at the bottom. You always want to just take a glance at these, especially when zero has been paid, because that means that the claim has been denied, and this area down here is specifically telling you why that claim is being denied. So again, today we discussed EFTs, electronic funds transfer, which is a direct deposit of monies from the insurance company to the provider, an EOB, or explanation of benefits, which is a paper pay stub from the payment that the insurance company made to the provider, and then an ERA, an electronics remittance advice, which is the electronic version of an EOB, which again electronically shows pay stub type information in regards to what was paid, what was denied, what's going on with the claim, how much the patient is responsible for, via electronic download opposed to the paper EOB.